Hello and good afternoon. My name is Dean Parisi. I'm the Director of CPT International at the American Medical Association. Today's session is a conversation with the AMA and SNOMED International. We'll be discussing four specific areas. First, we'll be talking about the release of the new SNOMED CT and CPT mapping product. Two, we'll take a historical view of how both organizations have collaborated. Three, we'll take a look back at how SNOMED International and the American Medical Association have responded to the COVID-19 pandemic. And then lastly, we'll take a look forward to see what the CPT code set and SNOMED International are doing with respect to future needs and future requirements. Again, my name is Dean, and I'm delighted to be joined by Laurie McGraw, Senior Vice President from Health Solutions, and Mr. Don Sweete, CEO of SNOMED International. Don, congratulations on a wonderful annual conference. I'm sorry that we are not able to join you in person this year. This has obviously been a challenging period where we cannot be together, but my understanding is that the expectation is with the COVID-19 coming to an end, we should be together in Portugal next year.
Indeed, we shall be in Portugal next year, fingers crossed, unless a new wave or new variant comes about. I want to welcome both you and Laurie for our conversation today, and welcome to our conference.
Thank you, Don. Again, it's a pleasure to be able to participate in the annual meeting again this year. So why don't we jump right into it? With respect to SNOMED CT and current procedural terminologies, I know the two terminologies have been quite active over the past couple of years, particularly with the response to the COVID-19 pandemic, as well as the advent of different technologies such as digital health and AI. So Laurie, the first question is directed to you. If you can perhaps speak to the broader collaboration between the AMA and SNOMED International over the past couple of years from your perspective.
Sure, I'd be happy to. And hey there, Don. It's great to see you. And I am looking forward to seeing you in person as soon as possible. Really appreciate the SNOMED team for hosting this excellent conference. We at the AMA are very happy to be participating here. But let me talk about the collaboration, Dean. I'm happy to. So we've been working at the AMA with CPT, with SNOMED for about 5 years. We've been collaborating really to do a number of different things. First of all, learn from each other, design the development of our respective coding and our terminology products, understanding strengths, understanding how we each continuously improve the different code sets and terminologies, where there are opportunities for integration and collaboration, how that can better inform the data landscape across the entire healthcare ecosystem. So we know a couple things. We know that researchers have taken great advantage of both CPT and SNOMED to inform different things as they conduct quite a bit of research, and data is particularly helpful in that regard. We also actually, through this, years of learning from each other, feel that there's great value that we can unlock by some combination, mapping and other potential with SNOMED and CPT. So basically, we are thinking and believing that the two terminologies can give health systems a really clear view of how the patient conditions can connect to all the various resources that are needed to deliver care. And we think there's great promise there. So it's been a terrific several years of collaboration, and we're looking forward to more of it.
Thank you, Laurie, for that insight in terms of the collaboration. Don, how do you see the relationship from your perspective?
Well, I think, and first off, I can hardly wait to see you, Laurie, and the rest of the American Medical Association team in person again. Can't wait for Portugal, and hopefully there will be some conferences in between as well. But welcome to our SNOMED conference. And from my perspective, and really the members' perspective of SNOMED International, the collaboration has really grown over the years. We started by trying to understand each other's needs, what their terminologies could do, what roles they play, and how they could, more importantly, work together for the benefit of the end users. We worked on a sandbox for vendors to come in and try out their software with the two terminologies. We've looked at tools as it relates to mapping the two terminologies. And really with today's healthcare system, where we know from the current situation with the pandemic that organizations and clinicians and researchers are craving data, but they're also craving data that is connected. And so the ability to have a clinical terminology connect with another terminology that provides that context around resourcing and effort is key to moving things forward. And that's why this collaboration holds great promise both today, but also for the future challenges that may come about.
Yeah, you're absolutely right, Don, and thank you for that insight in terms of the SNOMED International's perspective. So, Laurie, Don talked about the integration of the two terminologies, right? The clinical aspects of SNOMED CT as well as the supportive administrative perspectives of CPT, and bringing those two together and aligning them in a way that maps perhaps in a way that we've never done so before. So how do you see the advantages, in particular, how do you see them with respect to getting better visibility into data and having ministries of health and health regulators and other bodies across the globe use that for better insights into population health?
Yeah, well, so we know a couple things. We know that SNOMED is used across a lot of different geographies across the globe. We know that CPT is used in some of those geographies with, expanding to more. And some of the secret sauce, if you will, to CPT includes this understanding of the resources required to deliver that care. And in the area of population health and limited resources, whether it's workforce, whether it's supply chain, whether it's, whatever is needed to deliver care, understanding those resources is critical to then work on things like population health. How can there be optimal, whether it's access to care, whether it's improving the outcomes of care, as well as reducing and lowering the costs to deliver that care is critical. So we think that is, a tremendous opportunity for these two terminologies working together. We are very pleased to be at this conference talking about some new mapping between CPT and SNOMED so that that can be available to get access to those types of resource availability and understanding to help with population health solutions.
Thank you, Laurie, for that perspective. Don, again, similar question as it relates to the SNOMED International members as well as your organizations. How do you see the potential coming together in this product, in this tool that will be readily available to help your members and your member countries in terms of population health and perhaps additional secondary uses?
Well, from my perspective, and I have firsthand experience in working in a large health system within Canada, within my province. And the key thing that is missing at all levels is knowledge, and it's knowledge that has context and it has meaning. And as Laurie talked about, population health is the key to unlocking the ability of the health system to no longer be constantly reactive to things that are happening, but more predictive. So imagine, if you will, you have a clinical terminology that ties to a terminology that allows you to gauge what resourcing is necessary and how those resources are deployed and how you can deploy them with great efficiency to save money, reduce waste. That's the promise of the two terminologies working together, because whether you're a government, whether you're a large health system, a hospital, or even a public health operation in a certain region, having the ability to have a dashboard that gives you the trending of what's happening with the population health and the trends in certain areas, and then also knowing what resources are required and knowing that you can marshal those resources is a great advantage over where we are today. And that is again probably one of the best use cases, to have the two terminologies work in unison in order to provide that information to those that run the various systems.
Indeed, Don. Laurie, we talked at the onset during our introduction about COVID-19 and again, how the past 20 months have been quite challenging, not just within the United States, but really across the globe and in various countries around the world. Constituents, citizens, health authorities, health regulators. Obviously, there's been a focus on making sure that the health and the safety of our nations take top priority. Can you give some examples of some of the things that the American Medical Association, and in particular what we've been doing with current procedural terminology to respond to the COVID-19 pandemic and really to help our organizations who use the code set?
Sure. I mean, well, first of all, we're still in a pandemic, and hopefully we can see the light at the end of the tunnel, and we all hope for that. It's been an enormous time for all of us. I think, a friend of mine has talked about moving at the speed of need, and I'm really proud of the work of the AMA, the work of the CPT independent editorial panel, all of the advisors who did respond to the speed of need during this pandemic. So CPT, there's an independent editorial process that is the sole authority to curate, modify, change, and advance the CPT code set. And in March of 2020, when the world changed for all of us, the editorial panel got to work as we would expect them to do and moved at a completely different pace so that the code set, which is a current procedural terminology, could be responsive to the need for the coding to represent the types of medicine and delivery of care that was being delivered. So that means telehealth. That means new vaccine codes. The CPT editorial panel has been meeting on a regular basis. They have a very set schedule that was completely upended and accelerated. So 13 different out-of-cycle meetings. There have been emergency meetings for the recent vaccine codes. We've put forward something on the order of, 40 some odd telehealth, new digital medicine types of codes to be responsive to the pandemic. And that work continues. Of course, everything went from in-person types of meetings to virtual processes, but the level of integrity of the code set remains at its same level of high quality with the oversight of this independent panel process. And again, I'm just extremely proud of the work that these physicians have done to continue to curate the code set so that it could be ready, available with the appropriate educational resources to the needs of the healthcare systems that rely on the CPT code set.
Yeah, Laurie, thank you for that overview, indeed, and a couple of great examples there of how the American Medical Association and the CPT panel process has really responded with authority and vigor as it relates to the COVID-19 pandemic. Don, I suspect SNOMED International has been very busy as well in terms of your terminology and supporting, obviously, the needs of your member countries as well as licensees. Can you give us a couple specific examples or an overview of the good work your organization has done?
Sure, Dean. Similar to Laurie, I want to, at this point, issue a thank you to all of the staff of SNOMED International. That's similar to what has happened with the American Medical Association. We responded in January 2020 when the first iterations of the pandemic started to become reality, in producing codes very, very quickly for immediate use by those who needed them. I also want to thank our members and the member country national release centers who worked with us to continue to add content. So we have continued to add content from 2020, January 2020, right through until our latest July 31st release. Similar to what is being seen on the AMA side, we understand that there's more need, especially as it relates to trying to track some of the other things that are happening as it relates to COVID-19, such as long COVID, and the various changes that are happening in there. So for us, the focus has been getting the content out, not just in the SNOMED International release, but also putting it in the global patient set, so that everyone around the globe can have a core set of SNOMED CT codes in order to track COVID-19, to code COVID-19, to provide clinically relevant information for that virus as well. So all of that work has been underway, and it continues. And we actually work with our members as well to develop an implementation guidance document, which again is freely available. So people not only get the codes, but they understand the use case, they understand the scope, and they can actually use the codes and provide more intelligence for their on-the-ground troops in dealing with this pandemic that we're in right now.
Thank you, Don, as well, for that overview. It appears that SNOMED International has been quite busy as well in terms of responding to the COVID-19 pandemic and making sure that your members and your member countries are armed with the most up-to-date terminologies to again support the current situation. So as time is drawing to an end, I'd like to have pose one last question to both of you. In light of what has transpired over the past 20 months and in the learnings in terms of digital medicine and telehealth and how COVID-19 has potentially shaped or reshaped our healthcare delivery environment, Laurie, how do you see CPT in terms of going forward in terms of future requirements? How do you see what's transpired over the recent past, perhaps influencing or affecting our future?
Well, I mean, what the pandemic has taught all of us is, first of all, that we can be responsive and be up to these challenges. Stunning in terms of the people who put forward the expertise and the effort to keep these terminologies, again, to the level of quality that is required to describe the current medicine that is being delivered. So what will continue, we will continue to be extraordinarily responsive in terms of things like the advanced pace of the adoption of digital medicine, where it absolutely overnight was adopted around the globe. CPT will be at the ready. It will be responsive. We just recently published and passed through the editorial panel a digital medicine taxonomy, one that is available for AI, which is being more and more adopted in the delivery of care. But we also see future types of things that are coming at a faster clip in terms of their adoption because of the pandemic, and we must be ready to describe things like sensors, remote care, digital therapeutics, things of that nature. So the learnings of the pandemic, we will embed those into continuous processes, because staying current with the same high degree of quality, which CPT is known for, is paramount, and we need to be continuously ready for that.
Don, how does your organization see the future?
Well, similar to what Laurie's talked about, I mean, we've already seen some changes. I mean, right now, if you look at the fact that when you travel, you need a vaccine passport, and that passport has to have the vaccine codes in there in order for the countries to accept you for entry into their country. So that's a massive change from just getting on an airplane and flying across and showing one passport. Now you have to show two. I think what Laurie described, especially as it relates to what the challenges that the clinicians are facing as it relates to the new digital health, especially hits home in my country, in Canada, where we start talking about virtual care, where I may not see a doctor in person, I may see a doctor virtually. And so how do you deal with that? And so one of the things that we're trying to do in adapting to what the fast pace and change is to do frequent releases of content, so people can come and fetch those when the content is ready, as needed, if you will. And that allows us to very quickly adapt to that type of virtual care environment. And certainly having CPT being coupled and moving at the same pace allows organizations to have both the clinical terminology codes and the human resource type codes in sync so that they can move rather quickly in both coding the clinical side, but also putting it into context with the resource effort. And I think that that is important. And I think going forward, the key for us is to listen to what is happening on the front lines and seeing what is happening in clinicians' areas of expertise, and more importantly with researchers, because they are the ones that are kind of like the canary in a coal mine that are bringing things forward and saying, what if, and this may happen. Lastly, I think from an AI perspective, I think both organizations realize that the best way for AI to move forward even more quickly is to use both CPT and SNOMED CT as really the foundation on which to base AI, so that they have the past knowledge and the past learnings to help guide AI moving forward along with real world experience. So there's a lot going to be happening in the future, and the key for any standards organization, not just the AMA and SNOMED International, is to be ready and have the tools in place and completely modernized and ready to action anything that comes along.
Yeah, Don, it seems like both organizations are well poised to continue, obviously, to respond to the COVID-19 pandemic and the potential future waves to come, but really how technology gets embraced and utilized and how it changes the delivery of healthcare organizations across the globe. Regretfully, our time has come to an end. Before we close down today's session, I would like to welcome anybody to the AMA exhibit booth, our virtual booth this year. If you'd like to continue the conversation and/or have any questions about the upcoming product map that will be released, by all means, we'll have a staff there available to discuss further and answer any questions we have. Laurie and Don, I'm going to give you the last word. Laurie?
Well, it's just, I mean, it's always great to be at the SNOMED conference. Don, I'm really sorry that we're not together in person. You know, I always enjoy spending time with you, and we appreciate the collaboration. And we know from not just the pandemic, but just in terms of the needs of data and all the technology that's being adopted, that having structured terminologies to really inform that data, there's just tremendous opportunity. So the collaboration is strong. There's more that needs to be done, and we really appreciate working with SNOMED. So Don, thank you for that. You've been instrumental in making that happen, and we appreciate it.
Thank you very much, Laurie and Dean. I want to thank you both for your continued support of the conference. As always, it's great to get together. Sadly, it's virtual this year. Fingers crossed that we can meet in Portugal. And I think, again, the collaboration has taught us that while we're working in a specific area now, this is something that has global potential. And there's an opportunity for the two organizations to look at very specific use cases that are in governments, end users, clinicians need in order to make their life easier and better in dealing with whatever comes along in the future. So thank you for being with us in this collaboration and making it stronger than ever. And certainly I think the map will be a big interest item with anyone in healthcare, and that will be the stepping stone to future good things happening for this collaboration and for both organizations. So again, thank you very much for having this session, and enjoy the conference.
Thank you, Don. Again, thank you, Laurie. On behalf of the American Medical Association and SNOMED International, this concludes today's presentation.